To introduce you this article, we have to know that over the past 20 years, the incidence of total knee replacement has grown 2 to 10 times. And the post-surgery physiotherapy is aimed at improving pain, edema, and physical function. The water treatment versus ground treatment can use hydrostatic force to improve pain and swelling. And for this reason, water treatment is widely used, but despite the potential benefits of hydrotherapy, in the early rehabilitation stage, non-randomized trials have investigated the comparative benefits of land-based versus water-based therapy after total knee replacement. We have to know also that the water treatment is more expensive than the land treatment. The study design, a randomized single-blind trial of patient undergoing physiotherapy after primary total knee replacement, was conducted in an Australian metropolitan public hospital. And the outcome measure were assessed at baseline, 2 week post-surgery, after 8 weeks of rehabilitation treatment, and at 26 weeks post-surgery. The participants of the study were selected with some exclusion criteria. The exclusion criteria are post-operative deep joint infection, bilateral joint surgery, and documented dementia. And random allocation to the two different groups was achieved by the drawing of consecutively numbered, sealed envelopes by a person uninvolved in the study. So here we can see the participant flow or flow chart. In short, we have 186 participants, and of these, 84 were excluded for the exclusion criteria. So 102 patients were selected and randomized in two different groups. 49 of them are allocated to a land-based therapy or group, and 53 were allocated to the water-based group. Of these 53, one died during the study and the two lived the therapy. In the following boxes, we can see that the participation of the patient, which remained constant through the duration of the study. Assessment and outcomes. Patients were assessed by a blinded assessor, as we told before. And at baseline, demographic and anthropometric data, surgical details, and the presence of comorbid were recorded, and I'll show you a summary table in the following slide. Final results divide into primary and secondary outcome. The primary outcome is the distance traveled of 6-minute walking test, and the secondary outcomes are stair climbing power, or SCP. That's a scale that consider the body mass of the patient, the height of the stair, and the rise time. The WOMAC scale that consider pain, stiffness, and the difficulty of the patient in the movement, and the ROM of the knee in flexion and extension, and the edema. The treatment for the two different groups had the same frequency, intensity, and duration. For this reason, all patients perform 2 treatments a week, lasting 60 minutes, with the same physiotherapist, and are assigned also exercise to perform at home. The land-based perform in the treatment the exercise like cycling on a stationary ergometer, walking on a treadmill, climbing stairs, standing isometric, knee ROM exercise, and sit to stand exercise. The water group ground performed the treatment in a community pool, and the water temperature is 25 Celsius degrees. The exercise performed are walking forward and backward, stepping sideways, jumping, knee ROM exercise, and squats. What about the results at baseline? So 2 weeks after surgery, there were no statistically significant difference between the two different groups in outcomes that the study analyzed. And on the right, we can see how the demographic, anthropometric, comorbidity, and surgical characteristics are similar in the two different groups. To simplify all the results in the different phases of the study, I've built this table. As we can see, the distance walk in the 6-minute walking test increased with no difference between groups throughout the study duration, as we can see here. And also the pain and ROM and VAS change over the time with no differences between the two groups, as we can see here. The substantial differences at 8 weeks of treatment are due to stiffness. The land group is decreased more than the water-based group. At 26 weeks, the results are that SCP in the water group and the difficult in the movement of the patient and the edema are increased more in the water-based group than in the land-based group. So this study is interesting since water therapy has a higher cost than the land therapy. Both treatment led to very similar results and aquatic treatment was not very beneficial. The water therapy actually resulted in a better pain control and decreased edema, but these don't confer significant benefits to the patient. This study has also some limitation identified by the authors themselves, who are absence of a control group to compare the results with a natural recovery, and water temperature in the water group treatment, because higher temperature could give better result in the water group, and the duration of the study, because the results of the two groups may differ more after a long study period, like 1 year and not 26 weeks. Thanks for your attention.